Hi, Kara. Thank you.
How are you?
Good. And yourself today?
I'm wonderful. I'm wonderful. So,
Good, good.
we have about 20 minutes to chat here, and I'm
All
not
right.
sure if you want to open up for questions today or just chat. We can do that because we have a lot of people on watching.
Well, if I have time, sure.
All
Be happy
right.
to.
All right. Well, take it away and tell us about
Okay.
the low back and neck connection, and I will be.
Okay. Uh, if someone comes in with a neck pain, I'm going to treat that directly, but I'm also going to be looking for what else is out of whack with the spine, because sometimes if you have low back pain, or if there's trouble in the low back, there's also going to be trouble in another part of the spine, mid back or the neck. The spine is one whole structure, and it compensates. If there's problems in one part of it, it's going to compensate in another. So when, say, someone comes in, we'll start with neck pain. Say someone comes in with neck pain, I want to know exactly where it is, and I'm going to look at their neck. I'm going to check their range of motion side to side, see how they can turn their neck. I'm going to ask if there's any other problems, swelling or headaches, and see what else is going on with the neck. And sometimes the problem will start after a whiplash or after prolonged for years at a computer. And sometimes it doesn't manifest as pain, but it manifests as dysfunction. So if they're driving and to look in the back seat, or they have to turn their whole body, I know something is wrong. The neck is not as flexible as it should be. If they have difficulty swallowing, that's a problem. If they're have a dry cough, or if they're always trying to clear their throat, such as and no phlegm is coming up, then I know there's neck compression. If they have crepitus, where when they turn their neck, they hear the crunchies inside, then I know the muscles uh, over those neck cervical vertebrae, those muscles are too tight, and they're causing the vertebrae to uh, grind on each other. So we don't want that. I want to know if they're with the neck pain, is there jaw problems? If the mandible is out of place in the temporal bone, and the temporal bones might not be in sync. So all those things come into play. I want to know if they have a dry mouth. What else? Let's see. I want to look at their complexion. I want to know if they have headaches up here, forehead, or if they have problems in the teeth. I want to know if there's any hearing difficulties, because sometimes if the neck muscles are tight, not enough chi, or the energy, and not enough blood circulation is getting up to the head. Now, acupuncture works on a energetic level of the body, and you'll hear the word qi. Qi is a Chinese word for your vital energy, and it flows in pathways called meridians, and they're all connected. Now, if there is a blockage to that, it can be slight or almost a total blockage. The Chinese have a saying with regard to pain and the flow of qi, and they'll say, free flow, no pain; no free flow, pain. So my job is to get the free flow of the qi going. The qi and the blood work together, and if I can get the qi flowing, the blood will flow better too. So with say someone comes in, they have a neck pain, I find out where it is. I want to know the exact location of the manifesting pain, because then I can see which meridian or which pathway it is by. And then I can use another meridian in a different part of the body to free it up. And there's about 5 or 6 relationships there. So with the acupuncture needles that are very thin, I should have brought one in. I don't have to put the needles up here in the neck. I might be putting them in the medial lower leg. And so that's a good thing about that, because people are scared of needles, and when they do come in, I always ask them if they had acupuncture before. If they haven't had acupuncture, I stick myself in the arm and I show them the needle. I show them how thin it is. I stick myself, and then I usually say, "Can you handle that?" And they said, "Yeah." It takes the uncertainty out of the whole equation, and then I can treat. So what I'm doing is looking for, say, with neck pain, I might be going down to the lateral or the medial lower leg on the contralateral side. Say if I have right neck pain, I'll be treating left lower leg on the inside. And I'll be looking, I'll go up say the meridian or the area, and I'm looking for tenderness. If I feel with finger pressure, if I feel the tenderness, boom, needle goes in there. And then I'll have the person will be seated, and I'll have the person turn their head. And, we'll see if the edge starts to come off the pain. And then I'll go put a subsequent needle in and have them, again, turn their head. And so bit by bit, we get more chi and blood up there, and the pain should go away, and the function should return too. Now, a lot of times, a lot of energy goes through the neck to the head. So if all these muscles are tight, they're going to have headaches. They're going to have trouble sleeping. Um, their eyes might not work as good as they can. Uh, Skin complexion color isn't what it should be. So if you get the neck working really free, it can help the problem. Now, if the neck pain is in the back and starts to go down between the shoulder blades, then what I can do is I can have the person lay face down on a comfortable massage table or acupuncture table, prop up the prop up the put a bolster underneath their ankles, and I can put 2 needles in the foot, 4 needles total, two in each foot, and the needles go in about 3.5 inches up from the bottom of the Achilles tendon, and then 5 inches up. And what that does on each leg, that sends chi right up the spine to those muscles between the shoulder blades and the back of the neck, and it frees all that up. We're not just working with muscles here in the body. We're also working with connective tissue. Connective tissue is throughout the body. It's one continuous organ. Uh, the purpose of connective tissue, one of the purpose is that it resists high velocity forces put on the body. So if you've got whiplash, your connective tissue is slowing down the energy of the whiplash, of the impact, and but it'll also store that energy. So when you can, what the acupuncture will do is it'll change the electrical conductivity of the connective tissue. The the connective tissue will also carry a charge. So if I can get more chi into the connective tissue, it should take up water molecules and become more pliable. So, so when I'm treating neck, I'm also treating headaches, okay, because it's pretty close to the neck. And in that case, sometimes I'll see which meridians are up here are acting up, and I'll go all the way down to the other end of the meridian and put a needle on. For example, top of the head here is liver. So what I might do is put a needle on the foot between the big toe and the next toe, just between the two tarsal bones. I'll put a needle in there. That'll get the chi for that whole meridian working and take away the headache. Of course, there's other reasons for headaches, but if it's related to tight muscles in here and the neck and blocked meridians, that should help with the headache. Okay, so we want to get the okay. Now we want to look at back away and look at the whole body and whole spine. We're going to look at the lower back. Okay, and if someone comes in, usually if someone has long-term trouble with one part of their spine, another part of the spine is going to compensate, and they're going to have trouble down the line. So if they come in for, I guess, the neck, I'm going to look at the lower back too. Or if they come in for lower back pain, I'm going to take note of the neck. All right, let me back up here. Another problem with the neck is the shoulders. There's a muscle on the shoulder. There's a lot of muscles that work off the shoulder blade, and one at the top of the shoulder blade is the levator scapula, and it comes up to 4 vertebrae on the neck. Your shoulder blade should move over your back a bit, but if they're like locked down, they can't move as much. All of the muscles attached to that shoulder blade are going to be tight, or they're going to try to compensate. So if the muscle from the top of the shoulder blade to the neck is tight, that's going to cause the neck pain too. So sometimes I have to also treat the shoulders to treat neck pain. I also want to know what the person does with any type of pain. I want to know what their occupation is or how the pain started. If they don't know how the pain started, it might have taken place over many years. And sometimes it goes back to their what occupation they're doing. If they're at a computer for 10, 20, 30 years, and they never got any massage or anything like that, they're going to have problems. The head is going to be forward, and front neck muscles are going to be tight. So all that has to be loosened up. Now, I'll use the acupuncture to get energy in there. I'll also use a thing called craniosacral therapy, and I'll use some neuromuscular re-education to check the muscles here, or like a touch point therapy. And if I feel the muscles tight, I can just put pressure on different points and they will loosen up. And I want to see if the neck is, all the joints of the body coming up from the feet, the knees, the hips, if the joints are stacked one over the other. And if the head is too far forward, you're going to have problems with your neck. All right, so we're going to refocus here. We're going to come out and look at the whole body and look at the lower back, all right? And say somebody comes in with lower back pain, again, I want to know exactly where it's at. And I'll have them point to it with one finger. And I also will measure their leg length and their hip flexors, the two muscles that raise the leg on each side of the spine. If they're tight, they can pull the whole leg up into the spine. You might have a functional leg length difference. The actual bones are the same length, but on one side, if the psoas or the iliacus, the psoas comes from your lumbar spine, goes to the femur, and your iliacus comes from inside the iliac bone and blends with the psoas to lift the leg. If they're tight, they're also shortened, okay? And so if one side is more shortened than the other, you're going to have a leg length difference, and it's going to the sacrum. How can I say? Let me back up. Your lumbar spine sits on the sacrum. If one side is more tight than the other, it's going to be pulled to that side. So you're going to the lumbar spine, and a lot of times the vertebrae as a group will be going to one side. Now your body has reflexes that always keep us erect and so survival, so we can get out of danger. A group of vertebrae in the thoracic, lower thoracic, might be turned the other way. So you have this balance going up, but that doesn't make for really good posture, and scoliosis can set in if it's long term. So you want to make sure that see what the leg length difference is and go from there. And usually when somebody comes in for lower back pain, I want to get energy into all those tissues, so I'll do acupuncture. And again, you don't have to put the needles where the pain is at. So I'll have them sitting in a chair, and I'll put the needle for lower back pain on my arm, usually on the other side, on the contralateral side, right below the elbow, in here, if you can see. So I'll have some needles there. And I'll put a needle in and I'll have the person get up and walk, okay, and see if there's any difference. I'll have them come back, or I'll see if there's any difference, or has the side of the pain moved, okay? And then I'll put in another needle and another and have them walk in between. And usually as the chi gets in there, not only does the pain go down, but the walking becomes smoother, the gait increases, so and their balance is better. So um, you know, you just go step by step, trying to get the chi in there and get the muscles to release and elongate and rebalance out. And I always want to know why this pain came about. Was it an outright accident? Was it posture? Was it a sedentary lifestyle? Was it their job? Are they a salesman? They're in their car like 80,000 miles a year, or they're in a plane. I want to know what's going on with them. Do they play sports? Let me back up for, sometimes I can't, like for neck pain, a gentleman came in and he might have been mid 60s and I treated his neck and everything I did, it wouldn't stay, couldn't get anywhere really. Well, I come to the conclusion that the discs between the vertebrae were worn out. And in that case, he has to go see orthopedic and have an operation or make it so they can make a space there so it's not impinging the nerve. So if I can't clear it up, I'll refer out. But okay, so let's go back down to the lower back. So what I want to do is first see where the pain is, see which meridian is involved, use another balancing meridian, say on the arm, or I could even the other leg, and start to free up the side of the pain. Okay. Then maybe next treatment, I'll have them come in and I'll physically check each muscle in the leg and all the muscles of the hip. Here's your hips. And they have to move in phase. Okay. They can't be like this or just off. They have to be in phase and move in phase. Well, all the muscles of your legs are attached to the hips, your quads in front, your IT band on the side, your adductors on the medial, and your hamstrings. If any of those tissues are tight, it's going to restrict hip motion when you bend, and the vertebrae, your lumbar vertebrae, are going to take the strain. Also, if the muscles that lift the leg, your psoas in the front and iliacus, if they're tight, their pain referral pattern is lower back pain. Now, a hidden feature in a lot of lower back pain, and that gets by the therapist, is what they call the IT bands, or the iliotibial tract. I don't know if you can. If I got the books out, I could show you all this stuff. But there's a tract that goes down the side of the leg. Two muscles go into it. That when you stand, it will put tension on it, and it'll make sure your lower leg and your femur are in a groove, and you can stand up straight. Now, if your occupation is you're standing all the time on concrete floors, this and that can get too tight. And on your lateral leg, up on your upper leg, you can check if it's too tight by just pressing in. You're sitting there, and if you press in with your fingertip on your lateral leg, and if that's tender, that means it's too tight. Okay. Well, that needs to be loosened up. The fastest way to loosen it up is with finger pressure. And if it's too tight there, it's pulling, it crosses the knee. So the knee and the femur and the tibia are going to be grinding a bit. And up here and the hip. So as it's attached to the upper, to your gluteus max and another muscle here in the front. But it puts tension on your sacrum and on your SI joint where the sacrum meets the iliacus. So a lot of times that sets up, the person will come in and they'll say, I have low back pain, but the real cause of it is tight bands on the side of their upper legs, okay? And that has to be loosened up. And, a lot of times it's not, but that's what needs to be done. And how they do that is you put the person on their side, something for their head. They bend their hip, they bend their knee. You put a little bit of lotion on the lateral part of the upper leg, and you go up at like a 4-degree angle slowly, and bit by bit, all that connective tissue will release. And you do about 3 sets, and after each set, you work both legs because they're both usually tight, but one is tighter than the other. You have them get up and walk, and as that lengthens, it'll take pressure off the SI joint, and it'll take pressure off your lower back. So it's like magic, and your gait will improve, and your balance will improve. Now, sometimes I have to look at the gastrocs, your lower leg muscles, and if they're too tight, they attach on the femur, and if it's too tight, that puts pressure on the knee joint, and sometimes that has to be just released, and you can do that digital pressure. I can release that. So, say I used acupuncture to knock out the pain in the lower back, then I'll go back maybe next treatment and check all the major muscles that are attached to the hip to see if there's any tight areas, and release them. And you just do that with digital pressure. Just pressure in the right place, the muscle will let go. And then they ought to be on their way to getting over the dysfunction. Now, okay, I do the acupuncture, I do the neuromuscular re-education, I do craniosacral on the joints. Now, to have them to remedy the situation long term is they have to stretch. When you're fixing a muscle or the connective tissue, you want to take the hypercontractive area out of there and have it free up. When a muscle is torn or strained, the microfibers in the muscle there are broken. Intact fibers around that site will bunch up to protect the site, but that will interfere with blood flow, bringing oxygen and nutrients to the site, that part of the muscle, and taking waste products away. Also, that part of the muscle is tight, is shortened. If you have a lot of these areas in the muscle, the whole muscle is shortened and you've lost range of motion. So to rehabilitate all that, the first thing you do is with either acupuncture or massage or ice or whatever, you want to release that tight area. Now, the next phase in rehabilitation is you want to stretch that area. And so there's a thing called active isolated stretching that's very gentle. It's based on good physiological principles, and it works. And what it is you isolate a muscle, you take it through a range of motion. For example, my tricep. I'm going to stretch the tricep here. So what I do is I'll take it through a range of motion. When I hit the end point there, I'll take it 2 millimeters further for 2 seconds. That's it. So it's up, actively, passively, 2 seconds, 2 millimeters for 2 seconds, and down. The physiological laws there are, first, it's a reciprocal inhibition. Bicep is working, but the brain's telling the tricep to let go. Don't fight it. Okay, so because there's a sensor in there that if you try to stretch a muscle too far, it'll fire to stop the stretch to protect the muscle. But if I just go to my limit there and a little bit more, it doesn't fire, and I get an incremental stretch. Now, your whole body has connective tissue in it, and it's around the muscles. It's one unit. And 90% of it is longitudinal, but there's cross striations. But that connective tissue will, if it's a high velocity force on it, it'll resist it. But if it's a low velocity force like this, it'll take up water molecules and become more pliable. So what I do is show the person how to stretch using active isolated stretching, and I show them which books to get or which DVDs, and that's something they could learn, and they could treat. They could as a preventive thing, they could help themselves. So if they're at a computer a lot, every once in a while, they can do stretches for their neck.